itching, redness, dryness, cracking. These are the symptoms experienced by people with eczema. Eczema manifests in chronic inflammation of the skin. Atopic dermatitis is a common form of eczema. Approximately 10 to 20% of people worldwide develop atopic dermatitis. By watching this video, you will learn what eczema is, things that make eczema worse, and what you can do to control eczema. Eczema can occur in infancy, childhood, and adulthood. The majority of patients with eczema will develop it during infancy. Infants with eczema tend to have itchy patches on the face and scalp, especially on the cheeks. When eczema develops in an infant or young child, the skin may improve over time. For some children, the condition may resolve by age 2. During childhood, itchy patches develop on the back of the knees and the elbows. Of course, patches of eczema can appear elsewhere on the body too. Eczema also can be a lifelong condition. Fortunately, it tends to become less severe with age. Adults most commonly develop eczema on their hands. Some people who see their eczema clear during adolescence may develop hand eczema as adults. Now that you know more about eczema, what questions do you have?
How do I know if I have atopic dermatitis, that common form of eczema?
People with atopic dermatitis commonly have a personal or family history of atopic dermatitis, hay fever, and asthma. These individuals tend to have very itchy and dry skin. The affected areas may start off as itchy, red patches of skin. Then, as time goes on, these areas may become cracked, thickened, and discolored.
Since this condition is associated with allergies, can certain foods cause eczema?
While foods do not directly cause eczema, several studies suggest that certain foods can worsen eczema. Studies show some people with eczema may benefit from excluding certain foods from their diet. If you see a clear association between eating certain types of foods and worsening of your eczema, you may want to try a period without these particular types of foods to see if your skin improves. However, before you rush to eliminate foods from the diet, be sure to discuss the plan with a dermatologist or an allergist to establish a definitive link between the foods you eat and your skin symptoms. Some elimination diets can lead to nutritional deficiency and no improvement in eczema.
Can external factors worsen eczema? Should we eliminate these factors?
Many everyday objects can irritate the skin and cause atopic dermatitis to flare. Wool and other fabrics that feel rough to the touch, juices from meats and fruits, jewelry, and even some lotions can worsen eczema. Learn what irritates your skin and limit contact with these things. Eliminating contact with airborne substances, such as pollen, often provides little relief from eczema, but can be important in controlling hay fever and asthma.
So how do you treat eczema?
Effective treatment often involves both prescription medications and making smart choices about daily skincare habits. Because eczema is a chronic skin condition, it is important to keep practicing these daily, healthy skincare habits. These healthy skincare habits include application of topical medications recommended by your physician, frequent application of moisturizers, practicing special bathing techniques, and avoidance of triggers that lead to worsening of eczema. For patients with atopic dermatitis, it is better to select an ointment-based or cream-based moisturizer. This is because ointments and creams are in general more moisturizing. Patients with atopic dermatitis should take short baths or showers with lukewarm water. In fact, bathe only when necessary, such as every other day. Long showers and hot water dry the skin and can worsen one's eczema. After bathing, gently pat dry the skin and immediately apply the topical medication or a moisturizer. It is important to not let the skin dry completely before applying the moisturizer. When the skin is slightly damp after bathing, the cream will help seal the moisture on the skin. Applying a topical steroid or one of the newer immune-modifying medications to the skin can help reduce inflammation and itching. Sometimes, an antihistamine is beneficial. If the patient has an associated skin infection, an antibiotic may be recommended by your physician. For severe cases of eczema, a dermatologist may recommend ultraviolet light therapy or a systemic treatment.
What about the treatment of hand eczema? Isn't hand eczema usually hard to treat?
I have several tips for patients suffering from hand eczema. In addition to applying prescribed topical medications for your hands, protect hands against soaps, cleansers, and other chemicals by wearing gloves. Use an automatic dishwasher as much as possible. Avoid excessive hand washing. When one must wash the hands, use lukewarm water and very little soap. Immediately after hand washing, apply a dermatologist-recommended hand moisturizer. Again, an ointment-based or cream-based moisturizer is preferred. When outdoors in cool weather, wear gloves to prevent dry, chapped skin.
Will I ever be cured of my eczema?
For many, eczema is a chronic disease that may not go away. However, practicing the above recommendations can go a long way to keep your skin healthy. Consult with your dermatologist to see what treatment options are best for you, so that you will have the best weapons to conquer eczema. Yeah!